So what
as
do
soon
you
as
tell
possible.
what do you tell families to watch out for in their loved one?
Yeah, so once they're in a hospital, once they're out of the hospital, they're out of this risk period.
Okay.
But then generally, signs of stroke is really what people would be watching out for. If you're seeing someone starting having weakness, drooping of the face, or their speech becomes altered, they're suddenly starting to talk gibberish, or you can't understand what they're speaking. Those would be kind of the main things
Okay.
that people see.
So what are the long-term effects of having this aneurysm leak or the subarachnoid hemorrhage?
Yeah, so there is quite a long list of those things. As you can imagine, that is a big insult upon the brain.
Mm-hmm.
It's kind of like being shot with a shotgun. It's a huge amount of stress, and there could be an injury from the blood itself or from the stroke that happens afterwards.
Mm-hmm.
So a lot of people, up to 60% of the people, will have some sort of long-term consequence. If there is a weakness that develops, and let's say we're unable to open that blood vessel back up, there could be just a consequence of stroke, weakness, and disability that's related to that. And there could be variable degrees of that. Let's say some person might have only some weakness of their hand, some person might have complete weakness of one side of their body. They, might be requiring a lot of support and help and a lot of rehabilitation to get through it.
So this is something that could potentially get better with like PT?
Absolutely. Yeah, it kind of depends on how severe that injury is,
Mm-hmm.
how profound the deficit is, but a lot of times we can get at least some degree of improvement with really, really aggressive physical therapy. So all of our patients are getting that evaluation in the hospital. And then, some are lucky and they get through it. They never get any weakness or any other problems. And then some really need a lot and they need to go to a rehab or sometimes even skilled nursing facility if let's say they required the breathing tube placed because they were really, really sick.
Mm-hmm.
And let's say we weren't able to remove it. So they had to have the semi-permanent breathing tube placed through the neck. That's called a tracheostomy. That is also an possibility if things are really not going well and there's a lot of blood and maybe a bigger stroke happened and we're
Mm-hmm.
unable to open that blood vessel back up. So there is a pretty wide range of things that can happen.
Well, I'm going to ask a kind of a scarier question then. So you mentioned things really aren't going well. Does that correlate with age? Does that happen? Maybe with the older you get, the
Yeah, for
worse
sure.
it might get.
Definitely. The older we get, the harder it is to kind of bounce back from things like that. That's for sure. And that is going to always be a discussion, between the family, the patient, and the doctors about understanding kind of what the expectations are.
Mm-hmm.
Obviously, someone in their 70s or 80s is going to really be really hard for them to recover from a really bad bleed. And let's say if
Mm-hmm.
they required the breathing tube placed up front and maybe a tube placed through their brain to drain the spinal fluid because the pressure was really high upon the brain, that situation is really a lot of times really hard to recover from versus someone who's younger. A lot of times they can recover really well up to the point that they may not have any consequence out of this. So yeah, that's kind of the tricky part about it, is kind of understanding the prognosis, how all these factors play into it, how the clinical course is going to go for each person. It might be different. You might come in just with a headache and might end up having a big stroke.
Mm-hmm.
We're going to try and do everything we can to prevent that from happening. But again, there's just so much we can do.